The expectations of the white coat are enormous and undoubtedly already evident to you all. This privilege to enter the deepest, most private and tender regions of our patients' and their families' lives come with great responsibility and in turn deliver great satisfaction. And the professional satisfaction that you will receive is indeed one of the greatest gifts you will ever get in your life.
As medical students, you are bound by the same professional commitments that bind all physicians. Focus on the patient. Every aspect of what you do and who you are should flow from them. If you focus on the needs of your patients, you will get it right nearly every time. Your patients will love you and your colleagues will respect you. Most importantly, everything else will take care of itself.
It begins a journey that will allow you to have an impact far beyond the impact that people our ages might be able to have, that will allow you to establish a trust with people who believe deeply in what you are about. Even though they may not know you, when they walk in to get help from you, they believe deeply in what you are going to be able to do with them. And part of that is a consequence of the medical education you're going to get. Part of that is a function of values that you have. Part of that is a function of how each and every one of you work together, inspire each other, and go out and make the world a better place.
Our abilities to actively listen, appreciate context, employ critical thinking, make sense of complicated and complex clinical scenarios, and engage patients in needed behavior modification are going to be the skills that keep us relevant and distinguishable as physicians and sets us apart from other clinicians.
The key to your success as you embark on your medical education over the next 4 years and for the rest of your professional life is you need to become good listeners. This may sound trivial, but it would shock you to know how poor most of us do this simple task in our personal and our professional lives. We need to listen to the doctors, the nurses, the x-ray technicians, and all of the members of our healthcare team to do a good job. You need to listen to each other. You'll be amazed how much you will be teaching each other. And you need to listen to your patients. And to serve your patients well, you need to listen and learn from your professors, your teachers.
Always keep in mind that becoming and being a physician is a journey, not just a destination. And like all good journeys, the scenery is going to change from time to time and sometimes very rapidly. This change certainly applies to your medical education, practice of medicine, as well as the way you do things, the tools you use, and where you use them, as all these are constantly evolving.
An outstanding doctor can care for and make a difference in the lives of perhaps 1,000 patients in her or his career. That's wonderful. But an innovative, outstanding doctor can change the course of a profession and impact millions of lives in a career. That's truly extraordinary. End quote.
Remember that the patient and their families will almost always tell you what you need to know to help them. Just let them talk while you listen. Learn to listen.
Enough is enough to make a difference in the lives of people, to help so many people who have difficulties staying well or getting well, to help so many people in our community who otherwise would not have access to medical care that regardless of their zip code of birth or their socioeconomic status, they should have.
In the words of Sir William Osler, The practice of medicine is an art, not a trade, a calling, not a business. Chart your own course, create your own destiny, and be a leader in charting the course for future physicians as well.
A big part of the future of medicine lies in your ability to innovate. Do so and secure your patients and our profession's future.